Professor Mohammed Sambo, the Executive Secretary, National Health Insurance Scheme (NHIS), says the scheme will digitalize its services before the end of 2021. Sambo said the move was part of initiatives to herald the birth of what he tagged electronic-NHIS or e-NHIS.
One of the major reform issues that we are pursuing assiduously in NHIS is how to completely automate the process. That is the concept of e-NHIS, electronic-NHIS, so that there will be a paradigm shift between manual mechanism of driving NHIS business process to automating the process of the business process of the National Health Insurance Scheme. We want to see a situation whereby enrollment will be automated. You are in the comfort of your bedroom, you can enroll, get into the National Health Insurance Scheme, register, select your provider, select your HMO, and even make payment, only to come to the National Health Insurance Office to get an identification card. And with that identification card, or you can even, we are even muting the idea of electronic ID card. You can just move into the healthcare facility and you can be attended to. We have a minimum requirement for the healthcare facilities to be enrolled, to continue to be into the National Health Insurance Scheme. And we are hoping that through this process, the entire health system will be automated, where you have electronic medical records, where you can even do telemedicine, and so on and so forth.
He said NHIS adjusted its operations to achieve maximum results in the face of COVID-19 pandemic.
It is on record that at the beginning of the COVID-19, most of our healthcare providers have no sources of income. And we were afraid of the fact that a release of the National Health Insurance Scheme will be returned back. And we were not even sure that we will continue to have funding to be able to sustain our program. So what we did quickly is to look at our business process where we pay premium to HMOs on monthly basis, and they in turn pay premium to the healthcare facilities. We modify that to a quarterly payment. And I can tell you without any fear of contradiction, by the time we paid a quarterly payment to the healthcare to providers, it was the funding that stabilized most of the healthcare facilities during the onset of COVID.